Good day, ma'am, and to each and everyone. So my name is Eliza Crisopoulos from BSN1A of Iloilo Doctors College. And for today, I'm going to perform a turn demonstration in regards of assessing the musculoskeletal system. So prior to performing this procedure, we need to, of course, perform hand hygiene or hand washing and then our PP if there's necessary. So it is also important for us to prepare all the equipments needed, and for this assessment, we'll be needing a tape measure later on. So the next thing that we're going to do is to proceed with the assessment proper. Hi there, ma'am. Good day. How are you doing?
I'm fine.
Okay, that's great to hear. So by the way, my name is Eliza Crisopoulos and I'm your student nurse for today. Can you kindly confirm to me your name as well as your date of birth, ma'am, please?
Pepper Concofreros, November 6, 1971.
Alright, thank you for that. So what would you like to call you, ma'am? Is it by your first name or your last name?
First name, please.
Okay, thank you for that, ma'am.
Okay.
So the first thing that we're going to do is to identify our patient. So this is to ensure that we have the right patient in front of us. And it is also important for us to establish rapport and introduce ourselves towards our patient. So if there's any curtains or doors within the area, we need to close them in order for us to provide privacy to our patient. So the next thing we're going to do is to proceed with the explanation of the procedure to our patient. Alright, ma'am. So I'm here to perform the assessment of musculoskeletal system. So this is to ensure that everything is normal within your muscles, joints, as well as in your skeletal system. So if there's any abnormalities, just like if there's any swelling, occurrence of clicking or crepitus, you need to take note of them in order for us to prevent further complications. So do you have any questions to that or any clarifications?
No, ma'am.
Alright, so don't worry, ma'am. If you do have any questions all throughout the assessment, you'd have the freedom to do so, okay?
Okay, thank you.
Okay. So the next thing that we're going to do is, of course, to proceed with the first procedure that we need to do, which is what we call inspection. So we are going to position our patient. So first, I'm going to ask you, ma'am, to please stand. Okay, and please put your feet close together. Okay. So we are looking here at the posture of our patient. So standing erect. Okay. So as I'm inspecting my patient's posture, the posture is erect and comfortable for the age. So if there's any occurrence of slumped shoulders result from a poor posture or depression. So if there's any abnormal curvature of spine, which includes lordosis, kyphosis, scoliosis, or indications of herniated lumbar disc for the cervical and spinal cord. So here, I'm going to look at here my patient's cervical. Just stand straight, ma'am. Okay. Alright, so as I'm inspecting my patient's posture, the cervical and lumbar spines are concave, the thoracic spine is convex, and the spine is straight, so which is good. So the next thing that we're going to do is to check for the gait of our patient. So here, the base support, weight bearing, stability, we are looking for the foot position and arm swing as well as the posture. So here, okay. So the weight is evenly distributed. And the stand on knees and toes, and the toes point straight ahead with both equal sides and posture erect. And can you please try to walk towards me, right? Backwards. Okay. So the arms swing are in opposition, which is good. So the abnormal indication for this is if there's uneven weight bearing is evident and cannot stand on their heels or and toes. And if there is, if the toes are pointed in and out, that is abnormal indication, so we need to take note of that. So the next thing we're going to inspect here is for the shoulders as well as the arm of our patient. So we are going to palpate here as well the, can you please take a seat, ma'am? Alright. So we are going to palpate the glenohumeral joint here, the trapezius muscle. Okay. So we are looking here if there's any occurrence of lesions, a swelling. Okay. Alright, so the shoulder of my patient, as I'm inspecting it, the shoulder of my patient is symmetrical and no swelling, redness, or deformity that is being occurred. So the muscle also is fully developed, which is good. And also the clavicles here, the clavicles and scapula of my patient are evenly distributed, which is normal. So the abnormal indication for this, if there is a flat, hollow shoulder, are seen with this, usually with patients with dislocations. So usually the abnormal indication also is if there is a muscle atrophy. So the next thing that we're going to inspect here is for the elbow. So here we are going to check for the symmetry as well as the size if there's any tenderness or lesions. We're going to inspect and palpate. Do you feel any pain, ma'am?
No.
Okay. Alright, so as I'm inspecting my patient's elbows are symmetric. There are no redness or swelling as well. So the next thing that we're going to inspect here is for the wrist. Okay, can you please give me your hand, ma'am? Okay, we are going to inspect as well as palpate in this part of the wrist. Do you feel any pain?
No.
Okay, on the other side, please. Do you feel any pain?
No.
Okay, so I'm inspecting. There are no redness, there are no swelling, as well as there are no indication of tenderness, which is good. And the abnormal indication for this, of course, if there's a swelling that can be seen on the patients with, usually can be seen in patients with rheumatoid arthritis. So the next thing that we're going to inspect here is for the head and finger. So here I'm going to ask the patient, okay? Alright. So they are symmetry. Do you feel any tender or pain as I palpate them, ma'am?
No.
Okay, so there are no occurrence also of redness on the other side. Okay. You feel any pain?
No.
Okay, so fingers lie in the straight line, which is good. There are no also swelling or redness. So the next thing that we're going to inspect here is for the hips of our patient. Can you please stand them for a while? Okay. Look, can you please turn it back? Okay. Do you feel any pain?
No.
Okay, so the buttocks are equally sized, which is good. And the iliac crest are symmetric. Let me see. Okay. So the abnormal indication for this is if there is any deformed hip, if there is any dislocations on the hip of our patient. So we need to take note of that. So the next thing that we're going to inspect here is for the knees of our patient. Okay, can you please take a seat, ma'am? Here, I'm going to palpate here your knees, ma'am. Okay, do you feel any pain?
No.
Okay. How about this area?
No.
Okay. So as I'm inspecting, the knees of our patient is asymmetry and hollow. There are no swelling as well as the redness or deformities. So can you please stand, ma'am, just for a while? Okay, so the knees of our patient, the lower leg is aligned with the upper leg, which is good. So the abnormal indication for this is if there's any swelling, knock knees, or if there's any lesion. So we need to take note of that. So the next thing that we're going to do is to inspect for the ankles and feet. Can you please take a seat? Thank you. Okay, so here, as I'm inspecting the toes of my patient, the ankles and as well as the toes are pointing forward. Toes and feet align. Toes and feet align with the lower leg, which is good. So, okay, I'm going to palpate here. Okay, do you feel any pain?
No.
Okay, so the abnormal indication for this, if there is any painful warts or if there's any calluses that can be seen in our patient, so we need to take note of them. So far in my patient's case, there are all in normal finding. So the next thing we're going to do is to perform the range of motion test. So here I'm going to ask my patient to please open your mouth for me, ma'am. Close. Okay, other one. Okay, do you feel any pain?
No.
Okay, so there are no crepitus or clinking that can be heard, which is good. Can you please move your jaw side by side like this? Okay. Okay, good. How about move your jaw, pull and push over it, then. Okay, other one. Okay, so far performs a normal range of motion, which is good. So the next thing we're going to check here is for the cervical spine of our patient. So here we're going to ask our patient to do flexion and hyperextension. Can you please, ma'am, can you please put your chin on your chest, okay? Okay. Okay. Then look up in this, looking up. Okay. Okay, other one. Okay, and then good. Do you feel any pain?
No.
Okay. So there are no pain that is being cured, and the patient's flexion and hyperextension are at 45 degrees, which is good. So the abnormal indication for this, if there's any cervical strain, which is usually caused by neck injury or neck pain. So usually there are also patients that has a cervical degenerative disease and spinal cord tumors, which is associated by impaired range of motion. So the next thing we're going to check here is for tests for the lateral bending. So I'm going to ask my patient. Okay, ma'am, can you please move, touch your ear on the other side? Okay. So my patients perform a normal range of motion and that kind of test, which is good. She can bend at least 40 degrees on the right and left. So if there's any limited range of motion, we need to take note of that because it indicates neck injuries or abnormalities on our patient's case. The next thing we're going to check here is to evaluate the rotation of our patient. So here I'm going to ask my patient to look side here. Okay, on the other side. Okay. So the patients perform at the 70 degrees angle, which is good. So the abnormal indication for this, if there is also a limited of range of motion. The next thing we're going to check here is for the lumbar spine. So here we are going to ask our patient to bend forward. Can you please stand? Okay, can you be your toes? Okay, right, so we can see here that there are no abnormalities in terms of the spine of our patient. Okay, thank you for that, ma'am. Do you feel anything as you do the test? Okay. Can you take a seat, please? Thank you. Okay, so usually there is a 70 to 90 degrees flexion of our patient, so which is good. There is also no indication of tenderness, and the abnormal indication for this, if there is lateral curvature, disappears usually in patients with case of scoliosis or spinal process are out of line. So the next thing that we're going to do is to ask our patient to bend sideways to check for the hip of our patient. So I'm going to palpate also the pelvis of our patient. Okay, can you please stand up? Can you please do side by side? Okay. Hyperextension, lay back. Okay. If you anything. Or, okay. Can you do this? Alright. On the other side. Okay. Do you feel any pain as you do the test?
No.
Okay, thank you, Fred. You may take a sip. So far, my patients' performance are in normal range of motion, which is good. So if there is any low back strain, usually can be seen in patients with injury of soft tissue caused by impaired range of motion. So the next thing we're going to check here is for the range of motion of the shoulder, arms, and elbows. So we do the flexion and hyperextension. So can you do this one? Okay, on the other side. And you do the up and down. Can you please stand for me? You do this. Okay. You do this and all the way up. Right? Alright. And then up. And do this, right? This side, and up the back. Okay, do you feel anything?
No.
Okay, so far my patient performed well on the range of motion on her shoulders, so which is good. So if there's any painful or limited abduction accompanied by muscle or weakness, that is the abnormal indication. So the next thing that we're going to check here is extend the internal and external rotation should be 90 degrees. Can shrug the shoulder, flex, extend, and abduct against the resistance. So here I'm going to test here the strength of my patient. Can you do this test? Okay, now. Okay, can you shrug your shoulders like this? Okay, good. Alright. So the next thing that we're going to do, the range of motion, is to do the flexion for the elbow. We do the flexion, extension, pronation, and supination. So here should be, the patient should perform 60 degrees for 160 degrees for flexion, 180 degrees for extension, pronation 90 degrees, and supination 90 degrees. Okay. Okay, do this, both sides. Okay, that. Okay. And do this. And then. Okay. Do you feel any pain?
No.
Okay. Thank you. So far, the patient has a good range of motion. So the abnormal indication for this, of course, if there's a decrease of range of motion against the resistance, seems the patient if there is a muscle disease. So the next thing that we're going to do for the range of motion is for the wrist. So we are going to check for the extension, flexion, ulnar, and radial. Okay. Can you please do this now? Okay. Do this. Okay. This. Like this. Okay. Okay, thank you. Alright, so far there are no abnormalities. So if there is abnormal range of motion in a patient, we need to take note of them. So the next thing that we're going to check for the range of motion is for the hand and finger. We're going to ask our patient to open the hand and then do abduction, adduction, flexion, as well as the hyperextension. Okay, so I'm going to ask the patient to open your hand like this. Okay, good. And then close it. Open again. And then we are going to put our fingers down like this. Okay. Alright, good. Okay, up. And then here. Okay. Good. So there are no abnormalities. So the thumbs are away from the finger and the thumb is touching the base of the small finger. Can you do open this finger? Close. Open. Close. Alright. So the next thing that we're going to inspect here is to do the range of motion is for the hips of our patient. So I'm going to ask you, ma'am, to do the supine position, please. Can you please lay back? Alright. I'll move a little bit. Okay, so I'm going to ask our patient to do the abduction and adduction, as well as we are going to do the hip rotation, internal hip and then the external hip rotation. Okay, as well as the hip hyperextension. Okay, so I'm going to give you feel anything?
No.
In and external rotation. Okay. Can you please move a little bit in a prone position? Okay. Okay, so we are going to do the hyperextension. Do you feel anything?
No.
Okay, good. So can you do the supine position and can you face forward for me? Okay, you. Okay, good. So, alright, so far there are no indication of inability to do the abduction or to do the range of motion, which is good. And the abnormal indication for this, if there's any pain or tenderness that is being cured as I did the test, so we need to take note of that. So the next thing that we're going to check here or inspect for the range of motion is to ask our patient to stand. So we are going to test the, okay, can you please stand now? So we are going to test the knees of our patient. So can you please stand for me? Okay, you are going to raise for a little bit. Okay. Can you please raise your feet like this? Alright. The other side, please. Do you feel anything?
No.
Okay, so which is good. So if there's any decrease of range of motion that can be seen in the patient, it is can be seen in the patient with osteoarthritis. So the next thing we're going to check is for the range of motion of the ankle and feet. Can you please take a seat, ma'am? Right, so you are going to do dorsiflexion, plantar flexion. So you are going to put up. You're going to do this up, down. Okay, good. On the other side, up, down. Next is we're going to do inside and outside. Okay, do you feel any pain?
No.
On the other side, inside and outside. Okay,
No.
okay. So next is we're going to do the abduction. We're going to sway your feet here, side and side. Okay, other side, side and side. Okay, that's good. So far, my patient's range of motion are in normal, which is good. So the next thing that we're going to do is to do some of the special tests. So here we are going to, but before that we're going to check for the strength of our patient, strength the muscle of our patient from the upper extremities, right and left, and from the up to the lower extremities, right and left. So here I'm going to ask my patient to turn against hand on my face, okay? Ma'am, you are going to face right there as I'm going to. Okay, good. Alright, good. So the muscles of our patient are in good condition and in terms of her head rotation. So the next here is we are going to ask the patient to lift the shoulder to check for her strength as I pull it against her force. Okay, can you please shrug your shoulders? Okay, then, okay, good. So the next thing is we are going to bend the elbow and we are going to check for the strength of the muscle per patient. Can you please stand, ma'am? You are going to pull your hand as I'm going to do the exam against. Okay, good. Okay, good. Okay, so the next thing that we're going to check here is for the strength of the fingers of our patient. Okay, can you please crumple your fingers? Okay, have a force with it. Okay, as I do it against your force. Okay, good. Next is we are going to check for the hips of our patient. Okay, so may I ask you, ma'am, to please lay down. Okay, you are going to pull your hips. Okay. Yeah, you are going to put your force against mine. Okay. So we're going to take a seat, ma'am. Thank you for that. Next is I'm going to ask you to pull your toes against my force. Push. Pull. Push. Pull. Thank you. So the next thing that we're going to do is for the special test. So we are done on testing the strength of the muscle of our patient, and and they're all in normal condition, which is good. So if the normal indication, of course, if there's any pain, tenderness, or indication of swellings or lesions. So the next thing that we're going to check here is for some special test. So here we are going to do the LASEG test. So we are going to standing a leg raise. Okay, so I'm going to ask you, ma'am, to please lay down, please. Okay, so you are going to tell me if you do feel any pain as I raise your leg, okay? You do feel any pain?
No.
On the other side? Okay, good. So here we are going to test also for the ballotment sign. So here we are going to squeeze the top of the patella, and then you're going to tap it using the one other finger and observe if there is an occurrence of fluid. Okay, so if we see whether the floating or if there's a floating while tapping the, what do we call this? If there is any whether it's a floating while tapping the patella, the fluid accumulated under it, and indication of swelling or lesions. So the next thing that we're going to check here is for the length decrepency. So here we'll be needing a tape measure. So in this test, we are testing if the left leg is the if the left leg is the same size to the right leg. Okay, we are going to start the measurement from the hip up to the ankle of our patient. Okay. Okay. So far, there are no differences between the left and right leg of our patient, which is good. So the next thing that we're going to check here is for the bulge sign. So we are going to brush the proximal area of the knees as well as the lacrimal side of our patient's knees or patella. Okay. Here, brush them smoothly. Okay, so we are observing if there's any fluid at the midline of the knees of our patient. So if we see a positive fluid indication, here there is a possibly a sign or can be seen with patient if there's any lesions on the patella of our patient. So far there are no abnormalities, which is good. And for the next is for the nudge test. So nudge test is usually performed on the patient with old age and if the patient is handicapped. So in that test, we are testing the patient's balance as we nudge the sternum of our patient to check for the balance. We are done now doing the musculoskeletal system assessment, and we are going to perform hand washing and document all the findings that we already performed in this assessment. So that's all, and thank you.